Hi everyone, bonjour tout le monde. Welcome to another episode of The Politician and His or Her Idol. Bon samedi. I hope you're enjoying your Saturday so far. So before I introduce you to our special guest today, I would like to just highlight the purpose of this talk show, once again brought to you by BoXia and BoXia Media. We want to bring Canadian politicians closer to the population, closer to you, allowing you to discover a hidden facet of them. You usually see them in debates, on the TV perhaps, sometimes when you visit the writings office, MP or MPP's office, you don't really see them often. But it is important to acknowledge that they're humans just like us. They definitely have an idol or a source of inspiration that influenced who they have become today. And this person can be a political figure, an activist, an artist, etc., etc. So I'm really happy to have MPP Natalia Kusendova with us. She has been very busy lately though. So welcome Natalia, how are you doing today?
Good afternoon, great to be here. Thank you so much for inviting me. This is a very interesting show. I watched actually your interview with my federal counterpart, Omar Al-Gabra. So I'm excited to be here today. And like you said, to give a different perspective of what a politician is.
Thank you so much for being here with us. I was just going to mention that, I recently interviewed MP Omar from the same writing. So you guys really represent the Mississauga Center strength, I would say. Hope that, everyone from Mississauga Center are enjoying our talk show so far.
Yes, I'm sure they are.
Yes. So to be honest, I'm really excited to hear a little bit more about your idol because it's not usually or the usual person that we would normally expect from, a millennial. You are a young, beautiful, inspiring woman, and I totally thought that you would be picking a modern rock star, perhaps, right? So, Natalia, don't you think it's a little bit kind of special today?
I think so, and I actually have two idols, so I can talk about both.
Awesome. So anyhow, let me slow down a little bit, and we definitely have a lot of things to share and discover about you. So please feel free to make yourself comfortable.
Thanks.
So for those of you who don't know who our special guest is, MPP Natalia Kusendova, she's a conservative member of the Provincial Parliament of Ontario, representing the Mississauga Centre riding, as I mentioned before, since June 2018. Did I miss anything?
Not at all.
Awesome. I actually noticed that you speak 5 languages. So English, Polish, French, Czech, and Slovak.
That's correct.
And I totally relate to you as I also speak 5 languages. So just wondering, do you have a chance to practice them? Do you mix up these languages at all?
So that's a great question because in my brain, sometimes I feel like I'm mixing them all up together. So obviously English is my primary language. But as a parliamentarian, I get the opportunity to speak French quite a bit in the legislature. And so I've been, learning more French and taking lessons, etc. Polish, is a language that's very close to me. It's the language of my mom and my grandma. And so I do and we have a sizable Polish community here in Mississauga Center and across Mississauga. So I do get the opportunity to utilize it quite a lot when interacting with ethnic media. And then Czech and Slovak, well, those are the languages of my father and from his side. The Slovakian community here is much smaller, but we do have an Omni television program called Slovenský svet, which allows me the opportunity to brush up those skills. And so I do interviews for them every once in a while. But I would say Czech and Slovak are the languages that I use the least, even though those are the first languages I learned when I was a child.
That's amazing. That's so impressive. I'm really glad that you actually get to keep them and get to use them quite often.
Yeah, thank you. What about you? What are the languages you speak?
So for me, I speak Spanish actually as my first language, English, Mandarin, French, as well as a little bit of German that I have kind of lost a little bit because I don't really get the chance to practice. But I was born and raised in Spain with Chinese background. I moved to Canada when I was a teenager by myself. So ever since I have been speaking quite a bit of English, speaking school in English and French. I mean, I'm based out of Ottawa, so basically I get to use that on a daily basis. So that's my background.
I noticed the Franco-Ontarian flag behind you there, and so I just wanted to let you know that I actually had a private members bill that I introduced in the legislature this session to mark this flag, the Franco-Ontarian symbol, as an official symbol of Ontario. So to all our francophone listeners, bonjour, et je suis une francophile et j'adore parler le français et prendre chaque opportunité de le faire.
Je suis totalement d'accord. Moi, je suis aussi une francophile. So moving on, you have been very active lately, promoting and supporting businesses in your writing, and I actually saw you on social media, and the videos are very well done. So do you have a message for your constituents, families, and friends, our audience watching right now in Ontario, across Canada, and internationally even?
Yeah, absolutely. So we know that these are unprecedented times, and as a result of the COVID-19 pandemic, we all have been challenged in various ways. I had the opportunity to go into the front lines and use my skills as a registered nurse to help out in a local emergency room. And so I had the opportunity to see firsthand what's happening. And, it was very scary, to be honest. Every time I came into the shift, we had new protocols. Things were changing very, very quickly. And we were scared, frankly, worried that we would see the same images as we were seeing from Italy, that they would replicate here in Ontario. However, our government acted very quickly to put in place the emergency orders and certain measures to do everything in our power to prevent such tragedies from happening here in Ontario, as well as, making sure that we build capacity in our healthcare system and we have the appropriate number of ventilators, the appropriate staffing ratios, etc. And so I just wanted to say thank you to all Ontarians, my constituents, but all 14.5 million people of Ontario who have done everything in their power by staying at home, by practicing social distancing, social isolation, proper hand hygiene, by supporting our seniors and delivering meals to them. Because it's thanks to each and every one of us, each and every one Ontarian, that we were able to actually flatten the curve. And we didn't see, such an overwhelming, we didn't see our healthcare system and our hospitals get overwhelmed as we saw to our neighbors in the United States and across Europe. So huge message of thank you.
Thank you so much. It's definitely not been easy for anybody. The work continues, but we're definitely gonna get through this. So now it's time to reveal Natalia's idol or source of inspiration. So a person who actually influenced her, someone who impacted her life in a way or another. As I mentioned at the beginning, he or she is not the typical role model we were expecting. So Natalia, you actually mentioned two role models. Who are they exactly?
So the first one is Saint Pope John Paul II. For those of you who may not know, he was the Pope of Polish origin who led, the Catholic Church for many, many years. Previous to, we had two popes since he died. But coming, from a post-communist country, from Poland, John Paul II was always a source of inspiration for me because he really ushered in democracy and the changes that happened starting in Poland and across Europe to really bring down that Iron Curtain and the fall of communism. But what really struck me about Pope John Paul II was his ability to reach out across religions, across governments. And so he really was the Pope who loved everyone, loved all humans, irrespective of their religious backgrounds. And so he brought the world closer together. And so I think that's a great source of leadership. And especially during times such as communism and during wars, it's important to have, someone at the helm of the Catholic Church that leads with compassion and leads with love. Mm-hmm. And so for me, he was always a source of inspiration.
I was going to say that as well. He was a great man. He achieved many things during his pontificate. So it's, before you were actually elected as an MPP, you were a nurse, right? So your passion to help patients and the compassion you have for people as well. You're currently helping a lot of constituents too. Your role model, Pope John Paul II, obviously was a man of compassion, like you mentioned, right? And I believe you might be Catholic and Christian as well. So, I mean, did all these values inspire you to run for office, or was it a combination of things?
Yeah, so I think it was definitely a combination of things. I think what's important is that, in Ontario, we have people from all religious backgrounds and all walks of life and different ethnicities. And I think it's important that the Parliament of Ontario does reflect that. And so if you look at our Conservative caucus, we have people from all backgrounds, genders, religions. And I think that's important because we truly look the way that Ontario looks. So definitely my faith is a guiding principle that I use in my work as a politician, absolutely. But my nursing skills and what I've learned during nursing also contributes to the work that I do as an MPP, because there are many interchangeable skills, such as, listening to people with compassion, right? Problem solving. As a nurse, I always have to problem solve and troubleshoot. And as a politician, it's the same thing. A lot of interpersonal skills. So, I use those skills that I learned at the bedside today in my work as an MPP.
Awesome. Yeah, I completely agree with you. A lot of those skills are completely transferable.
Yeah, absolutely. And, I just wanted to mention my second idol, since we're talking about nursing.
Awesome.
So my second idol is Florence Nightingale, who is actually the person who started nursing, or the person who brought nursing as a profession. So Florence Nightingale was the pioneer in helping nurses, have a bigger voice and really professionalizing the job of what nurses were doing.
Perfect. And what would you say they have in common? Do they have something in common? Pope John Paul II and Florence that you just mentioned right now?
So I think just love of people. People who become nurses. You have to love people. It's not an easy job. You see people at their toughest times, at a time of crisis, and so the love of people and wanting to improve the lives of people around you, I think, is a guiding principle that both John Paul II and Florence Nightingale displayed.
Great. I actually have a quick question for your first source of inspiration. So for posthumously, right, he has been referred to by some Catholics as Saint John Paul the Great. So will you agree with this recognition, and are there specific reasons why you can say he deserves it or not?
Well, what I like to call Pope John Paul II is Poland's gift to the world, right? Because Poland was it's a significant country, but on the global scheme, it's a pretty small country, but it gave the world such a great man that truly changed the course of history. And so I think he does deserve the title The Great, because he reached out across so many nations and led so many missions that previous popes have not. And again, being that I forget the word properly in English, but the Pope that brings all religious leaders together, I think that's deserving of a title.
Awesome. Yes, I completely agree with you. And also, I noticed that he was one of the most traveled world leaders in history, right? I believe he visited even 129 countries during his whole pontificate. And he has done so much for humanity. And during those many travel moments, numerous humanitarian actions, and I would say just his entire life, are there any particular ones that you are very fond of?
So I remember very vividly when he visited Canada for World Youth Days. I think he's the one who established World Youth Days as as something that popes should be involved in. And I think it's very, very important, because youth are our future, and it's important to keep them within the faith. And, I'm not just talking about Catholic faith, but other faiths as well. I think, youth that are guided by principles of faith in general have a solid foundation and a moral compass. And so the Pope establishing World Youth Days as a part of the mandate of his work and his the work of the people who came after him was something significant. And so I remember when I first moved to Canada in 2000, and then I attended World Youth Days, I felt, like a little piece of home, a little piece of Poland came when he came. And so I remember I was a Polish scout and I wore my uniform. And although I didn't get a chance to meet him in person, just having that experience and that togetherness of being together with other youth in worship, I think is important. And I think sometimes young people are maybe not embarrassed to worship, but it might find it challenging to worship. The fact that the Pope made that as part of his mandate really, I think, enlightened and inspired many youths, and World Youth Days are still happening today, and so that's a great legacy of Pope John Paul II.
Yeah, I was actually just going to ask you this next question, but I think you basically answered it for me. I was just going to say that, as you mentioned, John Paul II, he was, from Poland. You also have East European background, so I was just going to ask you if he was the reason why he was your source of inspiration, and clearly you did say yes. Mm-hmm. Yes, and youth as well in terms of worship, I completely agree with you. There's many competing priorities and challenges, right, these days, and yes, the fact that he was encouraging that was definitely very inspiring.
Mm-hmm. Absolutely.
Yes. So for the audience who just tuned in, we are with MPP Natalia Kusendova. She's speaking about her idol or sources of inspirations, John Paul II. Most of this time. So are you ready to continue sharing with us maybe a little bit more about the other idol that you mentioned?
Sure, absolutely.
Awesome. So I'll need you to put on your nurse hat momentarily. Tell us a little bit more about John Paul's second death. So I read a little bit more about the facts, and it seems like a lot of details to me. But I can see that all started because he developed breathing problems caused by a bout of influenza, I believe. Mm-hmm. So are there any similarities in his case and the coronavirus, COVID-19, affecting the most vulnerable right now?
Mm-hmm. Well, I mean, that's a very interesting question. So if we look at the statistics and we look at coronavirus, we know that 95% of mortality is concentrated in, the older demographic. So about 80 years old and above. And people in long-term care. Usually what we see is that people who have comorbidities, such as diabetes or heart disease or others, are more susceptible to the virus than people who are generally healthy. And so, that's an interesting parallel that you draw. I know that John Paul II had Parkinson's disease, which advanced throughout his lifespan. I don't know if I would make that link in terms of his breathing problems, etc. But we do know that the coronavirus today affects disproportionately. The mortality is disproportionately concentrated in the elderly, and that's why it's so important that we do take measures to protect them in our long-term care sector and in our senior homes.
Thank you. So now you can take off your nursing hat and put on your MPP hat for momentarily, because it actually comes in handy. I can see that you have the official political setup in the background.
Yeah.
So the provincial government is currently taking quite a few measures to control the spread of COVID-19. Mm-hmm. So if you were in office back in 2005, when the Pope passed away, would you have done anything differently, or are there any additional measures you would have taken?
I mean, that's a very interesting question. 2005, I was still a very young person. I still consider myself young. I'm 31 years old. In fact, I was elected at 29, and I am the youngest female MPP for Ontario's 42nd Parliament. So, I think I can speak mostly to the last 2 years in government, but the reason why I went into politics in the first place was to change our healthcare system. We hear the phrase hallway healthcare a lot. And it is true, because when I was a new nurse working in the emergency room of a local hospital, I would often get the dreaded hallway shift. And what does this look like? It means that I'm working for 12 or 13 hours in a very narrow hallway with 4, 5, sometimes 6 bedridden patients at a time. And, without proper equipment, etc. And, I always said hallway is not a place of work, but it definitely is not a place of healing. So I would come home feeling very demoralized and very sad to see what our healthcare system looks like. And as Canadians, we're so proud of our universally funded healthcare system. And I would, ask myself, how is it possible that in Canada, in some hospitals, we have scenarios that look almost like a third world country? And so that was truly my motivation for getting into politics, because instead of just sitting and complaining how bad the working conditions are, I wanted to do something about it. And so that's when I ran for politics, and I was very fortunate to get elected to represent the people of Mississauga Centre. But I think healthcare is something that I'm very passionate about, and I always bring that nursing hat or that nursing perspective when discussing healthcare policy in our government. And so I can't really speak back to 2005. But I can speak to, what we've done for the last 2 years.
Great. I was just going to say, I think even during the pandemic, you have been taking quite a few shifts and long hours.
Yes, so I have been working in the hospital. When Parliament was sort of suspended temporarily, I decided that my skills will be best utilized in the front lines. And so I went back to my local hospital and been working there quite a lot. It was a very interesting experience. Every time I'd be coming in, we had new protocols, and with health and safety was our number one priority for both staff and patients. So we had a specific entry for COVID patients and a different entry for staff, different screening protocols, etc. So we saw the evolution of what the pandemic was looking like. Also in terms of personal protective equipment, PPE supplies, that was something that was really top of mind for our government and for the frontline workers. And you may see behind me here, we have some boxes of PPE, of some N95 masks, which were graciously donated by a local organization, the Centre Francophone du Grand Toronto. They donated 10,000 N95 masks, which I was distributing to frontline nurses. So, it was all hands on deck right at the beginning, all levels of government cooperating together, and us locally as MPPs, or even just as good people, businesses and individuals coming together asking, how can I help? We want to support our nurses. We want to support people in the front lines. What can I do to help? And so I truly, it was great to see that spirit of community and togetherness and helping each other, exhibiting the best of the Ontario spirit. And that was really the silver lining in this time of crisis.
Great. Thank you so much for all the help and your contributions. I see that you have done quite a bit. And on a more positive note, you did mention that you are actually the youngest female MPP in the 42nd Parliament of Ontario. So I'm just wondering if worship, we just mentioned that quickly, has actually played a big part of your life in your day-to-day, and maybe your career goals or personal goals as well.
So I think worship is very important. Of course, we live in a society where we like to separate the state and religion, which I support, and I think it's important. But the beautiful thing about being Canadian is that we have the Charter of Rights and Freedoms, which gives us our right to worship and the freedom of religious assembly. And so, yeah, absolutely. Religion plays a big part in my life. I was brought up as a Catholic. My mom is very religious and, goes to church every Sunday. These days I don't unfortunately have the time to go every Sunday, but I do my very best. But I love going to church because it gives me also that sense of community and sense of tradition. I belong to a Polish parish here in Mississauga, St. Maximilian Kolbe. But having said that, during the pandemic, we saw how important worship is and how important faith is. And when we had to close places of worship, we saw that people struggled. And I saw that viscerally, especially for people coming into the emergency room. And I was treating them as in the mental health ward of the emergency room. A lot of people were saying, my church is closed. I used to be able to go every week. This is where, this is important for my mental health. But not only the churches, also the auxiliary services that many churches and places of worship provide, such as peer support groups for new moms, Alcoholics Anonymous, Narcotics Anonymous, all of these different services that places of worship provide. All of a sudden, once you close those facilities, people were unable to access. So we saw a lot of challenges in terms of the mental health impacts on Ontarians with the closure of places of worship. So that's why I think it was very important that we came back as a government, and as soon as it was safe to do so, we consulted with our religious leaders and gradually reopened our churches, mosques, temples, synagogues, etc. So I think that's, and being in Mississauga Centre, I'm the MPP for everyone. And, I respect all religions, and I've visited all places of worship here in my riding. And so, and I think there's something beautiful about every faith. And so I encourage people to participate in their faith.
Thank you so much, Natalia. I really loved discovering the many different dimensions, right? Apart from just the nursing hat, the MPP hat. This is a really important dimension as well in everybody's, I guess, day-to-day and personal life as well.
Absolutely.
Yeah, so we don't really have much time left, but I would just like to ask you if you have any last words that you would like to share with our audience.
Well, I just wanted to say once again, thank you for everyone who has stepped up to the plate during the COVID-19 pandemic. We truly live in unprecedented times, but I think it's important to note that, politicians are people just like you. We have our challenges, we have our struggles. We wake up every morning, sometimes it's stressful, sometimes it's not, but I think it's important that we have that open channel of communication. And so I tell my constituents my doors are always open. I'm available by phone, by email, or in person when it is safe to do so. So, reach out to your local politician. Don't be shy. If you have an issue or a concern, give them a call. This is literally their job, is to talk to you. So, I love this show because it's about bringing people closer to your politician. And for those people out there who are thinking of a political career, especially young women or women in general, I'd want to encourage that because it's important to have those voices reflected in Parliament. It's not an easy job to be a young woman in politics, but it's so important to have that voice at the table. And many times, I walk into a room and I may be the only woman in that room, but it's so important that I'm there. And I just really, really want to encourage those young women or women in general seeking office to not be afraid. And if you have any questions, my office is always open, and I would love to answer them or to mentor people, regardless of which political party you are joining. It's important that we have those voices represented.
Yes, those are very encouraging words. So once again, thank you so much to MPP Natalia Kusendova. It was a pleasure having you here with us. So just can you quickly stay with me for a moment so that we can say bye to our audience together?
Absolutely.
Awesome. So for everybody watching us right now, hope to see you soon. Take care of yourselves. So don't forget to follow us on social media. The talk show broadcasts every Saturday at 11 a.m. Due to popular demand, actually, it used to be every other Saturday, but now it's every Saturday at 11 a.m. Same time, same channel. Donc, à bientôt. Prenez soin de vous. Hasta pronto. 再见. Natalia, it's actually time to say bye now. Once again, thank you so much.
Take care.
Bye-bye.
Bye.